DC Park RX, or DC Park Prescription, is part of a larger initiative around the country to get people to be outside, to go outside, to visit a park. It's special in that our focus with Park RX is for doctors and other healthcare providers to actually prescribe nature. We are now very much a sedentary culture. We have changed from an active culture of being outside, of playing outside, to now being inside.
So I'm a traditional medical doctor. I work in a hospital, work in a clinic, and 100 years ago, people died of infectious disease. Now people are dying of chronic disease. These are lifestyle-driven illnesses: diabetes, cardiovascular disease, dementia, which is hugely affected by lifestyle, many types of cancers, high blood pressure, obesity. All these things travel together. They're not individual diseases. They're all metabolic inflammatory diseases. And these come from many things we do in our lives and how we live.
Far too often we find that children are coming home from school. They sit down in front of a television set, then they have dinner, then they maybe study a little bit and they go to bed. And at no point during that are they enjoying an outdoor activity.
They're not moving is the problem, and they're spending a lot of time looking at a virtual world. So there's been a culture shift from moving to sitting.
We know from the literature that nature has a lot of benefits, and some of them are measurable and some of them are immeasurable. Those of us who do go outside and move every day, we don't need a blood test or some measurable parameter to tell us that's good for us, because we know that makes us happy.
I have noticed, even in my own child, that being outside has an amazing calming effect. And when I think back to my own childhood, I spent a lot of time outside, literally in the woods. And it was a very calming thing for me to do. And I think that as parents, not just as pediatricians, it's our responsibility to remember that and to try to recreate that experience for our children.
So national parks are a great place to be able to go out and enjoy some active recreation, but as well, they're a terrific place to be able to rekindle your spirits, to work on the mental well-being that's so important to all of us. A place to go out, oftentimes to be in a tranquil environment, a place that you can reflect, think about things, and just enjoy the great outdoors. So the National Park Service is working with the National Environmental Education Foundation, who is helping us connect with physicians here in the greater Washington, D.C. area with our Park Prescriptions program. It's a case where doctors, healthcare providers actually have a prescription pad, something we usually get to go get medication, but they write on that pad, get outdoors, enjoy yourself, go to a park in your neighborhood.
So for the last 3 years, what I've been doing is working with a number of other organizations in Washington, D.C. and around Washington, D.C. to rate all of the green space, which we generally call parks, here in D.C. We now have identified about 350 parks in D.C. alone, and we've used a standard tool to rate them for the kinds of things that I need to know as a doctor before I prescribe a park. So the kinds of things we rate them for are for safety, accessibility, and activity level, just to give you a few ideas of the things that we look at. So after we've rated the parks, then we have a one-page summary that we've created that corresponds to every park. And with those one-page summaries, here in the doctor's office, I am now able to prescribe parks in and around the area where my patients live.
So I'm trying to apply nature prescriptions to my work every day. We have a website called natureprescriptions.org, and we actually have a downloadable book called Nature Prescriptions. Now this is a local book that has local trails, but a lot of the guiding principles can be applied wherever you live. We actually host events too. So the shirt I have on now is from an event called Freedom's Run, which is really 5 events. It's a kids run, 1 mile. We have a 5K, 10K, half marathon, and full marathon that goes through 4 national parks. So it's introducing families to the parks. They can walk, they can run, they could start with a short distance. This is our 5th year. And what we've seen is people have just embraced this, and they started with a 5K their first year, and they've moved up and actually set a goal to complete a full marathon. but it's gotten them into the parks too. So it's kind of connecting that movement and nature, and it's become the largest event in the state of West Virginia.
Your doctor or healthcare provider often asks you now, do you wear your seatbelt? Do you drink? Do you smoke? We would like to add a question to that list of questions that you get asked no matter which healthcare provider you see and no matter when you see them, and that is, do you spend time outside?
So the Park Prescriptions program is just one of many ways for us to be able to work with the healthcare community in order to work with our publics, to use our national parks for folks to be able to get outdoors and enjoy some of these great spaces that are set aside for them. And it's a program that allows it to be altered or modified from different parts of the country. So you can take advantage of partnerships that you may have in your local communities. Not necessarily the same ones we have here, but ones that work for you.
Eventually, I'm looking for a paradigm shift. A paradigm shift in the way we live our lives, in the way we spend our time. I'd like to see the way we think about time inside and outside change. And not only in my patients, but I'd like to see a change in attitude and behavior in the doctors.
I think my ultimate goal as a father, as a health provider, as a citizen of America, is to create a generation that is healthier than my generation. Every generation for the last 3 to 4 has had higher disease rates, and now we are the first generation, our kids are going to be the first to die before their parents if we follow current trends. And with all the technology we have, that should not happen. So if we can connect all the right people, to this mission of creating a healthier society, growing healthier food, keeping the green space green, not building on it, developing programs that get kids just to embrace play, not specifically exercise, play, then I think we're getting somewhere.
By using our green space more, one of my hopes is that we'll have a better understanding of the importance of preserving outside, of preserving nature, of preserving one of our country's gems, in my opinion.
So the Park Prescriptions program is good not only for the current generation, but particularly for our young people, because it helps build our park stewards for tomorrow. A child who comes out and enjoys a national park today is going to find value in that, and they become those who in the future make sure that these places are preserved for posterity.
I'm hoping that we can call Park RX a success at the end of the day when we can see tangibly that the kinds of behaviors and attitudes toward parks have changed. This will be a success when we spend more time outside, when we recommend to our patients to spend more time outside, and when ultimately we're healthier for it.
It's not that I have to go exercise today, I get to go move today. And that's what I want every single patient I see to get that into their mind. Gosh, I get to eat good food. I get to go outside. Not that it's a chore, because we want this to be just unconscious behavior.
Every city, every county, every part of the country has parks. Every part of the country has populations of people, both pediatric and adult, who suffer right now from asthma, from obesity, from anxiety and depression. And all of these people would benefit from spending more time outside.
Is a different approach maybe than what we've seen for national parks in the past, where people thought they were somehow locked away. They were just exclusive places that weren't there for people. But, in our urban areas in particular, they're right there, they're right at the back door. They're made for going out and enjoying yourself and to be able to learn the great stories that we have to offer.
In 20 years of medicine, I've come to this conclusion: medical offices are for medical things. You go there when you're sick. But health occurs in the medical home's backyard. And that could be in your backyard, that could be a national park, but someplace that you're outside, moving and playing.